animation will show how atherosclerosis develops in the heart. Click the navigation arrows below the animation screen to play, pause, rewind or fast forward the animation. Atherosclerosis is the process by which arteries become gradually narrowed and hardened. If this happens in the arteries that supply the heart, it causes coronary heart disease. This can lead to chest pain called angina and eventually a heart attack. The network of blood vessels that branch over the surface of the heart are called the coronary arteries. Atherosclerosis can happen in any part of the coronary arteries. The coronary arteries supply the heart with blood. Over years, fatty deposits in the blood can build up and form a plaque or atheroma on the artery wall. This can prevent the heart muscle from getting the blood and the oxygen supply that it needs. This tends to happen during physical exertion or when angry or stressed. It causes a heavy or tight chest pain called angina. Afterwards, the pain goes away. If the plaque continues to grow, the risk of having a heart attack, where the blood supply to the heart is completely cut off, rises. This is the end of the animation. Click on the animation screen to watch it again.
The American College of Physicians and 5 other medical specialty societies have issued 2 clinical practice guidelines for diagnosing and managing stable ischemic heart disease. Stable ischemic heart disease is a major public health issue affecting an estimated 1 in 3 adults in the United States. The prevalence of ischemic heart disease increases with age, and approximately 23% of men and 15% of women aged 60 to 79 in the United States have ischemic heart disease. Although survival of patients with ischemic heart disease has been steadily improving, it was still responsible for nearly 380,000 deaths in the US in 2010 alone, with an age-adjusted mortality rate of 113 per 100,000 population. In the evaluation of ischemic heart disease guideline, we recommend that the patients with chest pain receive a thorough history and physical examination to assess the probability of stable ischemic heart disease prior to additional testing. This is followed by electrocardiogram to rule out heart disease or other tests such as stress tests or coronary angiography. Choices regarding diagnostic and therapeutic options, they should be made through a process of shared decision-making between the patient and physician to discuss the risks, benefits, and costs to the patient. Regarding the management guideline, we recommend the treatment strategy. It needs to start with patient education about ways to reduce risk, such as with healthy diet, exercise, avoidance of smoking, and weight control. Education on it's really important on adherence to medication, and information on how to recognize worsening cardiovascular symptoms and take appropriate actions are also critical. We do not recommend certain risk reduction strategies because we did not find any evidence to support any benefit. These 2 guidelines, they include over 100 recommendations, and they go each and every step of evaluation as well as the management.
atherosclerosis is a life-threatening disease that may have begun to develop during childhood. This condition is a process in which deposits of fatty material, called plaque, build up inside the walls of arteries, reducing or completely blocking blood flow. In extreme cases, this disease can lead to a heart attack or a stroke. Risk factors for atherosclerosis include high blood pressure, high cholesterol, tobacco smoke, diabetes, obesity, and physical inactivity. Although the exact causes of atherosclerosis are not clear, many scientists think it begins with damage to the inner wall of an artery called the endothelium. Over time, substances traveling in the blood, such as cholesterol, fats, and cellular waste products, accumulate inside the damaged area of the arterial wall. Chemical reactions occurring within the buildup of material cause cholesterol molecules to oxidize. This initiates an inflammatory response in which the endothelial cells at the damaged site release chemicals that signal a call for help. In response, monocytes from the bloodstream travel to the damaged site. Stimulation from oxidized cholesterol plaque. As the plaque increases in size, the arterial wall thickens and hardens,